Imagine sending a text without lifting a finger. Not with your voice, not with your eyes, with nothing but a thought. For one man, that isn't imagination. He's paralyzed from the shoulders down, and he plays chess, browses the internet, and moves a cursor across a screen using only the electrical whispers inside his brain. This isn't a concept from a film. It happened. It's happening right now. And it marks the beginning of what may be the most profound shift in computing since the smartphone. The brain chip revolution has already begun. To understand why this matters, look at the entire history of computing as one long story about removing barriers. The computer removed paper. The smartphone removed the desk. It put the machine in your pocket. And as we've explored on this channel, AI glasses are now trying to remove the phone itself, so information reaches you without a screen. See the pattern? Every era, the distance between what you want and what the machine does gets a little shorter. A brain-computer interface aims at the final barrier. Not the paper, not the desk, not the screen, the body itself. It asks a startling question. What if the machine could respond directly to your intention, before you move a single muscle? That's the promise. Now let's be honest about the reality. Start with what's actually inside your head. Your brain runs on electricity. Around 86 billion neurons, constantly firing tiny electrical signals to one another. Every thought, every movement, every intention you've ever had is, at its root, a pattern of these electrical pulses. When you decide to move your hand, a specific storm of activity flickers across a region called the motor cortex, before your hand ever moves. A brain chip, or brain-computer interface, is a device that listens to those signals. Think of it like a translator sitting at the border between two languages. On one side, the electrical language of your neurons. On the other, the digital language of computers. The chip's job is to catch the brain's signals and hand them to artificial intelligence that learns to translate intention into command. That's the entire idea. Read the signal, decode the meaning, turn it into action. So how does that translation actually happen? In 4 steps. First, recording. Electrodes, some thinner than a human hair, sit close to the neurons and pick up their faint electrical chatter. Second, decoding. This is where AI is essential. On its own, that chatter is meaningless noise, but machine learning models are trained to recognize which patterns mean move left, click, or the word hello. The AI learns you, specifically, your brain's unique signature. Third, transmission. The decoded intention is sent wirelessly in the newest systems to a computer, a phone, or a robotic arm. Fourth, feedback. The person sees the cursor move, adjusts their intention, and the system learns from that correction. Over days and weeks, human and machine tune themselves to each other, and the control gets sharper. Read, decode, transmit, refine. A loop that closes the gap between a thought and a screen. Now the crucial part, separating what has genuinely been done from what remains a hope. Here is what has actually been demonstrated in real people. Individuals with paralysis have controlled a computer cursor by thought, clicking, typing, browsing. In early 2024, a young man named Noland Arbaugh received an implant and within weeks was playing video games and chess with his mind. By early 2026, he had logged thousands of hours, and the trial had grown to more than a dozen participants. Others have moved robotic arms to feed themselves. Researchers have begun decoding attempted speech directly from brain activity, giving people who've lost their voice a path back to conversation, sometimes approaching the speed of natural talking. And here's the line you must hold on to. Every one of these is a clinical trial. Experimental, investigational, These are extraordinary medical breakthroughs, restoring abilities to people who lost them. That is real, and it is happening today. But restoring vision, writing full sentences at natural speed, controlling a whole home by thought, those remain active research, not settled capability. The miracle is genuine. It is also early. A handful of organizations are driving this, and they've each made a different bet on the same fundamental trade-off. The deeper you go into the brain, the clearer the signal, but the greater the surgical risk. Neuralink, the best known, sits at one extreme. Its coin-sized implant places over 1,000 electrodes on ultra-fine threads directly into the cortex, inserted by a surgical robot. The deepest signal and the most invasive path. Synchron made the opposite bet. Its stentrode is threaded up through a blood vessel and lodged near the motor cortex. No open brain surgery at all. Lower resolution but dramatically lower risk. It has reached around a dozen patients, holds an FDA breakthrough designation, and has even demonstrated controlling an Apple headset directly from brain signals. Precision Neuroscience, founded by a Neuralink co-founder, threads a film thinner than a hair onto the brain's surface without piercing it. And in 2025, it cleared an early FDA hurdle for short-term recording. Paradromics and Blackrock Neurotech round out the field, chasing high-bandwidth communication for people who are locked in, different architectures, different risks. And critically, as of now, none has yet won full FDA approval for a permanent implant. This is a race still being run. But surgery isn't the only path, and this is where the technology may first touch ordinary people. Non-invasive interfaces read brain activity from outside the skull using sensors on the scalp. The same basic principle as an EEG. No surgery, no risk, available today in research and even some consumer products. The trade-off is steep, though. Reading signals through skin and bone is like trying to follow a single conversation from outside a stadium. You catch the roar of the crowd, not the words. So these devices can sense broad states, like focus or relaxation, and simple commands. But the precise, fluent control that lets someone type or move a robotic arm, that still requires getting close to the neurons, which today still means surgery. And that surgery is only the first of many real obstacles. This is where honesty matters most. There's surgical risk. Any brain operation is serious. There's longevity. Some implants degrade over months as the body shifts around them, and one leading system has struggled with its threads pulling back from the tissue, weakening the signal over time. There's signal quality, still far from perfect. Then come the harder questions. Privacy. Your neural data may be the most intimate information that has ever existed. Who owns it? Who can read it? Security. A device connected to your brain must never be something that can be hacked. Regulation. Proving these are safe enough for healthy people will take years of evidence. And cost and access. If this works, will it reach everyone or only a few? None of these are small. Together, they're the reason this revolution is measured in years, not months. Which brings us to the question everyone asks. Could a brain chip replace your phone? Let's reason through it honestly. In principle, some phone functions map neatly onto a brain interface. Typing by thought, silent messaging, navigating menus, controlling smart devices around your home. Those are conceivable extensions of what's already being tested. But others almost certainly won't migrate. Your phone's camera, its screen for watching video, its role as a physical object you hand to a friend, a brain chip doesn't replace any of that. And here's the honest bottom line on timing. The first medical approval, an implant prescribed for paralysis, is, according to many clinicians and analysts, plausibly a 2028 to 2030 event. And even that isn't guaranteed. A healthy person choosing elective brain surgery to skip their phone? That's not on any credible near-term horizon. The surgery, the risk, and the ethics all stand in the way. Experts genuinely disagree on whether it ever becomes mainstream at all, and anyone who tells you they know the date is guessing. So let's end where the evidence actually stands. The history of computing has been one long act of erasing the distance between human intention and machine response. Paper, desk, screen. Each barrier fell in turn. The brain-computer interface reaches for the last one. But the revolution isn't arriving in your living room this year. It's beginning somewhere far more meaningful, in hospitals and research labs, where it's giving movement and voice and independence back to people who lost them. That is not science fiction. That is happening now. The mind-controlled future everyone imagines is still distant and still uncertain. But the first, real chapter, the one that restores what disease and injury took away, has already been written. The brain chip revolution has already begun. It just began exactly where the most important revolutions always do, with people who needed it most. Subscribe to Auravox AI for more videos about artificial intelligence, robotics, automation, and future technology. Click below to continue exploring the AI technologies shaping tomorrow. Like this video if you want to see more content like this, and share it with someone who's curious about the future. Don't chase the future. Own it.